Welcome students. In this session, let us continue with the unit 1 of abnormal psychology, which is Introduction to Abnormal Psychology. Learning objective of this session is to help you all understand the different criteria of abnormality and to understand the meaning of abnormality from the point of view of statistical criteria. Next, the session outcome. After this unit, you all will be able to understand the meaning of abnormality from the statistical criteria. Let's start with the criteria of abnormality. Criteria means basis, okay, on what basis a particular behavior can be considered as normal or abnormal. In this unit, we have to learn about 4 different criteria of abnormality. But in this session, we'll be discussing about the first important criteria of abnormality, which is statistical criteria of abnormality. According to this criteria, abnormality will be defined only on the basis of how rare a particular trait, thinking, or behavior of an individual is. If a trait, behavior, or thinking is very unusual or rare, then it will be considered as abnormal. But one important thing to be considered is how rare a particular phenomenon should be. Okay. For instance, in the normal population, the IQ range is between 85 to 115. If it is less than that, or if it is greater than that, then it is abnormal. But how much deviant it should be from the norm is to be decided. Statistical criteria is based on the assumption of normal probability. Okay, so it is assumed that in any given trait or behavior, 68% of the given normal population will fall in the range of +1 or -1 from the mean. For example, if the mean IQ score is 100 plus and SD or standard deviation is 15, then 100 plus 15 is 115, 100 minus 15 is 85. So 68% of the people will have their IQ in the range of 85 to 115. Okay, so if it is less than that and significantly less than that will be considered as MR or mentally retarded. And it is found that about 2% of the people in the normal population will have their IQ very significantly less than the normal range of 85 to 115. In this slide, we see the diagram of normal probability curve. Okay, normal probability curve is a bell-shaped curve which will be bulged at the center, indicating that majority of the people fall in the center. Okay, just see the first picture in which the normal population is colored, wherein they all fall in the center, and the percentage of normal population is about 68%. In the other diagram, there is a split. For instance, 68% is the normal population, out of which 34% will fall slightly below the mean and 34% will be slightly above the mean. Okay. After that, this is between plus or minus 1 SD. After that is the 14% and beyond that is 2%, and towards the fag end or towards the two extremes is 0.1%, which shows that such behavior are statistically rare or statistically very unusual. Those are the behavior towards the extremes that will be considered as abnormal, whereas the behavior that centers around the mean, about 68%, will be considered as normal. Next slide. In statistical criteria, where to start the classification of abnormality is very arbitrary. In the previous diagram of normal probability curve, we just saw that anything beyond the 2SD can be considered as abnormal, but that cannot be applied in all the cases. Who will decide and how it is going to be decided is very important. When we talk of IQ again, if at all IQ of 70 is normal, and if somebody has an IQ of about 69, then it will be very difficult to label him or her as abnormal. Okay, but setting the cutoff is very important and yet very difficult. Next thing, when we talk of mental disorders as such, Statistical criteria says any behavior that is unusual and any behavior that is rare is abnormal. But certain kinds of mental disorders like depression have higher rates among the normal population than it is expected according to the statistical criteria. So it becomes difficult to decide that, yeah, whether depression is going to be normal or whether it's going to be abnormal. In statistical criteria, any behavior that substantially deviates from the statistically calculated average will be considered as abnormal. What is important here is it is not just the deviation, but it has to deviate substantially. Okay, markedly it deviates from the statistically calculated average. Next point says if a behavior of a particular individual is like the golden mean or it is like the majority of the group. If they are like the majority of others, then they are normal. If a behavior deviates from the majority, if it is different from the majority, then such behavior will be considered as abnormal. Statistical criteria is used to define or determine some kind of psychological abnormality. For example, mental retardation is based on statistical accounting. Previously, we saw that NPC, right, normal probability curve. If the behavior is statistically deviant from the golden mean of 100 IQ, then it is mental retardation. Meaning of mental retardation is significantly sub-average or below average level of IQ. Along with this, these individuals will also have problems with coping with life in general, or life skills will be deficit. Strengths or the merits of statistical criteria are as follows. Firstly, this criteria helps to explain the meaning of abnormality in the statistical context. So it tries to explain what is meant by normal and what is abnormal from a statistical point of view. Secondly, it helps to make a cutoff point for diagnosis. It helps in diagnosis, but by making one cutoff point. This is the point, beyond this is abnormal, within this is normal. So that cutoff point will be set by the statistical criteria. By setting the cutoff point, this criteria makes it easy and simple to understand whether a particular behavior is normal or abnormal. Lastly, it always tries to measure performance against the average performance. Limitations of the statistical criteria. The first limitation of this criteria is that it is inflexible. There is a degree of inflexibility. This criteria states the top and the bottom 2.5% in any given population are abnormal. But certain disorders like obsessive compulsive disorder is found among 3% of the population. But not all these 3% fall in the top or bottom extremes. Some of them may be very much in the normal range, which is plus or minus 2 SD from the mean. Such people, though they fall within the normal range, they may have symptoms of abnormality. Such important things are not considered by statistical criteria. In this slide, let's continue with the limitations. Another important limitation of statistical criteria is that it only says any behavior that is unusual or rare is abnormal, but it does not consider whether the behavior is desirable or undesirable. The desirability factor has not been considered by the statistical criteria. To evaluate whatever is being told, if at all we talk of obesity, obesity is much more rampant in the normal population, which means it is statistically normal. Though it is statistically normal, from the health point of view, it is considered as undesirable. Another instance is of being gifted, genius, or having very high IQ. Having very high IQ is statistically abnormal because it is very rare. But when we think from the desirability point of view, it is highly desirable to have very high IQ. Next point is there are certain characteristics which may be very rare but have no bearing on normality or abnormality. For instance, being left handed. The population percentage who are left handed are very less, but still it has nothing to do with normality or abnormality. What is important to be considered here is any behavior that is rare or rather, all behavior that is rare cannot be abnormal, and it is important to consider whether a particular behavior is desirable or undesirable. So, such a point of view may be potentially dangerous. To summarize, in this session, we have discussed in detail the statistical criteria of abnormality. Statistical criteria tries to explain normality and abnormality in a statistical context. We have also discussed the strengths and limitation of statistical criteria. Thank you.